welcome everybody to another webinar hosted by radarhealthcare. We had the first part of this series was covering the new single assessment framework by the CQC. And I know firsthand that lots of you have been asking lots of different questions around the single assessment framework and what it means to your organization. So the first session, we really uncovered with our speakers some of the key challenges, some of the key opportunities that are available to organizations up and down the country. And this second session was set up to see what would be Radar Healthcare's response to it. But I'm delighted to be joined by a couple of speakers today, some of which you already know. We've got a new member to the team, so I'll allow them to introduce themselves first, and I'll start with you, if I may, Julie.
Thank you, Simon. Hello, everybody. My name's Julie Rayner, and I'm the Care Quality Governance and Compliance Director for Hallmark Care Homes. I've worked in this role with Hallmark for almost 9 years, and prior to working for Hallmark, held a similar role in another organisation. But then prior to that, I worked for National Care Standards Commission, Healthcare Commission, and latterly CQC. And I worked in those organisations as in a managerial position, so managed teams of inspectors. So nurse by background as well, so strong background in clinical care and regulation.
Brilliant, thank you, Julie. Antony, would you like to introduce yourself?
Hello, everybody. I think many of you will know me. My name's Antony Hall. I'm actually the Director of Regulation now at HC1, and I'm the nominated individual for HC1's 238 English homes. And I apologise for the way I'm dressed in a T-shirt today, but I'm actually talking to you from Greece, and it's incredibly hot, so I couldn't possibly bear to wear a shirt. So delighted to be here today.
Well, thank you for making us all jealous, Antony. And last but not least, our very own Mark Fewster.
Hi, Simon. Hi, everyone. Mark Fewster. I'm the Chief Product Officer at Radar Healthcare.
Thank you, Mark. And just to complete the set, I'm Simon Qasir. I'm the Chief Revenue Officer and a Board Director for Radar Healthcare. Look, we've got lots of things to cover today, and I thought I would start our discussion today, if I may, Julie, by coming to you first and just describing how governance compliance is managed across the Hallmark care homes. I know lots of your homes, if not all of your homes, are either good or outstanding. So I'm sure our listeners today would be delighted to hear how have you managed the preparation for the new CQC single assessment framework. What practical steps have you taken so far? And later in our conversation, we'll perhaps look at how some of the radar technology may be able to impact some of that. But I think if we start with that, how have you been preparing for this new single assessment framework?
Yeah, thanks for that introduction, Simon. And yes, absolutely. All of our English homes are either good or outstanding with CQC. And we've currently got 6 homes in Wales. And whilst the Welsh regulator aren't awarding quality ratings at the minute, we have been given shadow ratings, and all of our homes that have been inspected in Wales have achieved the highest quality rating of excellent. Albeit that's not publicised, unfortunately. So yeah, I mean, quality is really high on our agenda in Hallmark. You know, and we saw the new single assessment framework as an opportunity to be able to demonstrate and show CQC the fantastic work that we do within Hallmark, but inevitably we had to think about and modify how we presented evidence. You know, because previously when an inspector walked through the door, you know, and then you had a modicum of control, you know, they could also experience and see and feel the atmosphere of the home and the fantastic work that the team were doing and the relationships between the residents and the team. So we had to, as I say, we had to modify and think about how we could present that quality and that outstanding care in a different way. And I think the first thing that we wanted to do and we needed to do was to keep all of our team in the loop so that everybody was aware of how the new framework was developing and growing. I was fortunate that my head of compliance was on the CQC development group. So, you know, we were always on the front foot with what was coming out from CQC. So as I say, we were able to keep everybody in the loop of the developments and how things were going. We developed training and we have presented training and delivered training to all of our team, inspection readiness training we call it, and that has been delivered to our heads of departments, you know, so our general managers, and then throughout the whole team base, including, you know, all of our carers, our housekeeping team, our laundry team, our kitchen team, you know, so just so that everybody is aware that they all have a place to play in evidencing to CQC the fantastic things that we do. We also, in Hallmark, we do internal quality audits. So we reviewed those quality audits and we made sure that they were measuring the same kind of things that CQC would measure. So we strengthened the resident team family voice in that audit. So the audits now absolutely concentrate a lot around what people are telling us. We looked at ways in which we could get that evidence from Radar to be able to demonstrate the positive feedback that we are getting from families and from residents and from team as well. We thought about how we could capture other types of evidence of feedback and of positive outcomes for people. You know, so we've used Radar a lot to be able to do that. And another thing that we set up to make evidencing outcomes and quality easier was that every home now has a set of CQC evidence folders on a shared drive. You know, so those evidence folders are in each of the domains and then drilled down into quality statements so that the team and our departments at central support can put evidence into those folders as well, so that when CQC do come calling or, you know, ask for evidence, we've already got a framework of evidence sitting there waiting to be presented to CQC. And then obviously, you know, we would be capturing the in the moment evidence from our Radar system. So lots of things we did, Simon, to prepare for the new assessment framework, you know, and I believe that we are currently in a positive place. You know, we know what we're doing. We know what we've got to hand to provide CQC with. I believe our team are also, you know, fully aware of what their place is in this. You know, and as I said before, with Radar, you know, we can easily get at that point in time evidence. We can run reports to provide with CQC.
Yeah, that's great, and there's several things that have resonated with me from what you said there, Julian, and probably to you as well, Anthony. The key word, which I know you love to talk about with the single assessment framework that Julie has used, it was an opportunity, and I just want to come to you now, Anthony, and just see a month on from that first webinar. What are your thoughts around the opportunities that this process has presented to you and HC1? And I'm sure you can resonate with some of the things as well that Julie touched upon about changing the mindset of the frontline carers into thinking in a slightly different way in order where evidence could be first thought rather than something that historically wouldn't have been the first thought. So how's a month from our first CQC been resonating with the new with this new single assessment framework to you, Anthony?
Yeah, thanks, Simon. And similar to Julie, I mean, we've done an awful lot of preparation with our homes across the regions, and I think we're in a kind of really good place in the sense of people's awareness of the framework. I think, you know, and Julie's absolutely right. this is, and many people have heard me talk, this is a huge opportunity, because I think if you do care well, you look after residents well, and you put residents first, this is an opportunity for a first time in a long time to be able to demonstrate that and do really well with the framework. I think in answer to your question though, Simon, I think the answer for me lies not just in the quality statements themselves, but the evidence categories. And there lies the opportunity, because the evidence categories are inviting us effectively to demonstrate the wonderful experience that we give our residents, as well as the feedback around that care, whether it's from the resident themselves, their families, the staff, the leaders in the home, but also our external partners, and how we move and work and integrate with those external partners. But I think also one of the most powerful things for me is something that certainly my HC1 colleagues on this call will know and hear me talk a lot about, is observation. It gives us the opportunity to use observational techniques and just general observation to improve the service. And I think that's an incredibly powerful thing. And I'm quite often surprised when I go and speak to in various fora about the how few people use observation. And of course, at CQC, and similar to Julie, I worked at CQC for 12 years, and observation was an integral part of the inspection methodology, particularly in dementia communities. But I think observation can be done by so many people in different ways, without using necessarily the in-depth tools that CQC may use, like Sophie 2, but you can engage your frontline staff to do observation. You can use your residents, you can use your relatives, you can use external healthcare professionals who visit your home to use observation to really give you those second pairs of eyes and show where the service can improve. And I think that's incredibly powerful. So in answer to your question, Simon, I think it's that demonstration and bringing to life to our frontline care staff the importance of delivering the best possible experience in the best and kindest way, but then also using observation and let's really work those evidence categories to our advantage.
Yeah, thank you, Antony. And again, Mark, I'll come to you now and probably continue this theme about opportunity.
Yeah.
When the challenge was laid before you that there was going to be a new single assessment framework presented, how did you and your team manage that opportunity that was presented? What was the thought process that went into creating what we can see on screen here, the new CQC dashboards that you and your team have put together? And ultimately, I think for our viewers, it would be quite interesting to hear how does the journey go for a technical product like Radar in putting something that is quite people focused into the technology? How do you manage that process?
I mean, in terms of the actual design process, so I guess the first thing is actually understanding. So obviously the framework changes and you need to be at a level of understanding where you can have a sensible conversation with a customer. So for example, Antony and Julie, so we need to get up to speed super quick on what's happening. We need to really get, a deep understanding of it ourselves before we think about how we want to actually answer the problem. And then I think for me, it's maybe kind of sound like I'm oversimplifying a little bit, but just listening to, almost what Julie said and what Antony's just said, gives you the steer on actually here are the things that are really important. So the change is all around evidence. It's all about quality of evidence. And then actually where are the opportunities within that? It's in around capturing the feedback. It's around how do we manage things like observations, and how do we have the evidence in a central place where for our customers, for our users, it's just really easy for them to be able to kind of, couple of clicks and they're into that particular data set. So that's kind of the key ones for me is just really making sure, and this goes through everything we do, to be fair, that the customer's at the heart of the design of the products, not just in this case, this new CQC framework and the dashboards we're going to demonstrate, but actually kind of going forwards for that and all of the projects that we work in. So our process typically is process of understanding, process of development with real customer engagement. So in the nicest sense, they're helping us design the solution because ultimately they're going to be the people who are using that solution.
Olivia just put on screen here for us, Mark, where suggestions have been made from the customer base, from the Radar customer. Quite often we are, we get a lot of requests, right? So how do you manage those requests? And I think this screen properly describes how the thought process of what we develop next, where it comes from.
So, I mean, this is just one of the mechanisms we use for capturing feedback from customers. We have beta groups, we have forums, we have sessions where we get together customers and talk about specific topics. For this one specifically, this is where we have a community forum where people can put ideas for the product forward. And then those ideas are voted for by the rest of the customer base. And it's not always as straightforward as the most votes go to the top, but basically looking at those ideas that people are putting forward, we then think about what we want to develop and what matches to the strategy, to the roadmap, but probably more importantly, and tying into Antony's earlier comments, what are the things that we develop that can actually have an impact on patient safety? So how can we arm the customers with information to help them make better decisions, help them prioritize what actions they need to undertake? So here, thankfully it's a nice start. So 32% of all ideas that have ever gone through the community we've implemented. 18% are planned, so that's literally nearly 50% of everything that's gone through we've done, and then we've got 50% of the ideas at the moment that are open for people to vote on and to discuss. So again, repeating myself, the customer's at the heart of what we do in terms of how we design the products. We listen to the customer, we work with the customer's design, what the product ends up being.
Yeah, and the purpose of this second webinar, the highlight, I guess, is going to be the demonstration of what has been produced, and we'll come to that in a second. Before we go to that, I think it'd be really useful to the viewers, and certainly bring in our speakers at this point. There were two event types that have been created that are different. And it would be useful, Mark, if you just talk that through. And I wouldn't mind hearing directly from Julian and Antony what that may mean to them before we go to the demo, if I may.
Yeah, that's fine. So two new event types. One is basically a CQC event where you are able to put in the scores you've got for your WE statements in effect, or transfer your existing legacy CQC scores into this new framework. So that gives you the ability to be able to measure and track against any of your registered sites. And then the second one is basically an observation event, which can be, again, not wanting to kind of steal the thunder of the demo, but can be internal or external. So you've got a mechanism there for allowing your staff to do observations. So pick a care home, for example, observations on a resident. But equally, you can also give those to visitors, family members, where they can do observations as well. So again, back to almost what, again, Julie and Antony were mentioning, you've now got this mechanism for getting the feedback in, getting the observations in, and actually being able to track and maintain those CQC scores.
Julie, I'll come to you first. What are your thoughts, initial thoughts? Two new event types are going to be added onto the events module in Radar. How does that sound to you?
Yeah, I think that sounds a fantastic move forward. I think it's going to be really valuable to be able to track, across the services CQC outcomes. But what really makes my ear prick up, Mark, was when you're talking about the observation piece. Because what I'm thinking straight away there, at the minute, our team record in hard copy the impact of, anything that they do with the resident, so I don't know, it could be an activity, and they would record what impact that has had on the person. So I'm immediately thinking, from an observational point of view, they would be able to capture that on that event, wouldn't they?
Yes.
Yes. Which then, when you think about capturing that information on paper, how difficult it is then to track and analyze and to come up with anything useful from that paper. If you then have it on a digital system, my mind is just exploding here with the opportunities of what we would be able to provide and the analysis we'd be able to make. So I think that is incredible. Yeah, that is so helpful.
Yeah, thanks, Julie. And Antony, I know you've had a sneak peek yourself. You've seen the new two event types. Has that manifested in any ideas and how you may work that through some workflows in Radar?
Yeah, I mean, I think if you're going to building on Julie's point about observation, I mean, I think observation is only as, you know, and the interactions staff have to be positive. They have to make a difference to that resident, or because in my view, there's very little point doing them if they don't. And that can be as simple as, you know, how you present somebody with a cup of tea to something more complicated in terms of personal care. And the ability to be able to, not that we'd observe personal care, obviously, but the ability to observe all those other interactions and actually then be able to quantify and analyze whether they be positive, negative, or neutral actions is very important. And I think the other point is that, and again, I'm not stealing to steal the thunder here, but the ability for this to be a form that anybody can use in our homes is going to be absolutely vital, I think, and is a game changer for me. So, but I won't steal Mark's thunder on that.
Yeah, that's fine. Well, I think we've whetted everyone's appetite enough. Olivia, shall we go to the demonstration of the new radar solution? I think we'll move to that.
So we will start the demo looking at the CQC dashboard. So the idea behind this is it's a single place where you can track basically the latest assessment details. So obviously the CQC framework's changed slightly as we've been through on the previous sessions, and we're now still tracking the same domains, but we're interested in the we statements. So the idea behind this dashboard is for each of the registered locations, we would have the ability to be able to track and monitor the scores against the assessments against that particular location. In terms of this demonstration, what I will do is I'll go through the dashboard and then I'll run through how we aim to link it to the evidence for the inspection, the feedback, the learning, and the observations, which for us is a brand new event type. So if we start with the event that's driving the dashboard, so within Radar, we've got a number of different events. I'm going to go in, I'm going to report a brand new event. In this case, we're looking at an inspection, so we're in the inspections category. I then pick the particular registered location. Then going to choose the type of event, so in this case it's CQC ratings, and then basically enter a description. So in reality that would be kind of commentary around the actual inspection itself. And then what's happening here within Radar is it's going to kind of present a form. That form, in essence, really straightforward. It's just basically putting the numbers in from the assessment. You can also translate your current assessment into the new framework as well. So if you've got your last CQC inspection, you can just map that straight across. So the principle behind this is, I won't fill in the form, but basically you'd fill in the whole form, and then the dashboard is basically being powered from those events that are being tracked.
Do you think that particular event type could be used for a mock assessment?
So yes, I think the thinking behind this event type is obviously this one is primarily for your actual last assessment. You can duplicate this and you can create another event, in essence doing the exact same thing, and that can be for your mock inspection, mock assessments. So again, in here, in terms of your tracking, you can just tag it with mock inspection or call it mock inspection, and then just change the difference between the two.
Gotcha.
So if you imagine we've been creating a number of different events in here, and we've obviously got, this is the latest score from the assessments. We're doing the totals at the top, so 19 out of 32 for safe, for example. But we're also tracking what the average performance is across all of the different areas. We're tracking the scores as they may change over time. We're tracking the change since the last visit for the individual domains, but also for each of the individual we statements as well. Going back to the event, one of the key things in Radar is the action plans associated with with any event, really. So if I go into recorded events, I'm going to pick one of the last CQC inspections. And then in essence, we've got our form, that's the information that we filled in. But now actually we've got an action plan step. So at this particular point, the actions that would come out from that particular assessment inspection, you can link to some that already exist within the system, or you can go in and you can create a brand new one. So it's a CQC related action. I'm going to give it a high priority, and we're going to give it a date. So we want it done by the end of August, and we're going to give it a tag, and let's tag it against one of the domains. So we're going to say it's safe. And then what we're able to do here is basically link our latest inspection or our mock inspection to some action plans that we want to be able to complete. And then what Radar's doing is it's tracking those action plans against those CQC assessments inspections, and you can manage those centrally as well. Moving back to the dashboard. So one of the one of the key changes in the framework really is around, it is almost around these different categories. So actually, when you're being assessed on the we statements, it's about the quality of the evidence, and it's about the feedback that you're getting, not just from internal staff, but from external bodies as well. Could be visitors if it's a care home, for example. It could be patients as well. So the way we've kind of built the dashboard is to be able to link into all of these different categories. So here, for example, we're at Greendale, we're at this registered site. We want to look at the evidence for this particular location. The principle is in one place, you can now demonstrate, one, how you're managing these things. So again, these elements of, you know, you shouldn't have a number of overdue audits, you really shouldn't have a number of overdue action plans, but more importantly, you can go in and actually look at the data that sits behind it. So the idea behind the dashboard is that CQC dashboard becomes almost that central place where you're then able to go off and deep dive into the rest of the evidence that might be related to that particular assessment. So again, we'll just show that again. We're going to go in, we're going to look at some evidence. We've got our summary KPIs. We might want to look at some trends, see what we're doing in our events, how our audit scores have been created. We might look at top fives for different areas, but then if we're into something that we want to look at specifically, well, how are we doing with our audits? Again, it's literally click of a button, and now you're into the dashboard that's related to the audits for that location. So again, aim being, you're literally able to go in and get the information that you need from one place. In conjunction now, we've got feedback as well. So feedback for us, complaints, compliments, concerns, excellence reporting, PALS, NHS, patient feedback, friends and family tests. And again, same principle. So the evidence was mainly around things like operationally, how are you doing? What do your audit scores look like? What types of events are happening and how many? This is similar, but it's about the feedback. So it's about how many complaints have we got? How many concerns have we got? How many compliments we've got? And again, the same principle here is actually, if I'm interested in compliments, it's literally click of a button. I'm now into the compliments dashboard. And again, I'm into the specifics for that particular area. So again, you know, how many compliments have we got? How are they changing over time? What were they about? Where did they come from? Which locations are, you know, best, worst in inverted commas for compliments? So the principle being the central place driven from the CQC dashboard, where we're grouping the things that are relevant to that assessment and enabling you to just go in with one click and drill into that detail. I'll move on to observation. So before showing you the actual dashboard, I'm going to go back into Radar. I'm going to create a brand new event. And in this case, we're in the feedback. Again, I'm going to pick my location. I'm going to pick my observation. You'll notice there's an external observation there. So we have a QR code, which will be on screen now. And this QR code should enable you to just see what an external observation looks like. I'll kind of talk through that as I'm doing the demo of the normal observation. You can be looking at it as I'm talking. So again, we're putting a little bit of the description in. And this is, again, the idea, thinking behind this is to give a tool and the ability for staff, for visitors, for family, basically anybody who you want to gather observations from. So any kind of, you know, anybody who might be interacting with the people that you care for. The principle behind that type of event is you can use it internally, where it might just be staff driven, or you can use it externally. So pick staff. It's going to be who. So I'm just going to pick Ellie. It's going to say, well, where are we doing the observation? And again, these lists can be configurable because this is, you know, this is just our default out of the box select options. You obviously have different kind of locations within your organizations and your locations, so you'd be able to change those to something that's relevant to you. So let's pick all of the home in this case. Guidance here. So again, we're just using some text that we've felt kind of relevant as a placeholder. If your guidance for observations is different, we can change that as well. So again, all of this is configurable, but we're interested in mood states. We're in a care home in this example, and we're interested in the mood states of the residents. And then we would go through and we would add observations. So who are we observing? Again, we're picking residents. Could be a patient, for example. When did we do it? What was their mood state? What was the engagement? So what were they doing at the point in time that we were monitoring them? So in this case, maybe they were engaging with another resident. Who was that other resident? And then any staff interactions, how many good interactions, neutral interactions, and poor interactions, and then any kind of comments and things that we would want to add to that. And I'll save that. And then we can do multiples if we want to do more for the same person, we can do, and we can just continue to add those as we do the observations. It's kind of a slightly stripped down version, and that's the sort of thing that you probably have on a QR code where, as I say, it could be, friends and family, visitor, somebody else visiting, for example, who can just go in and do observations. And then the data from that, and this is the key bit, the data from that now drives the observation. So if I go and click and have a look at this dashboard, so we're obviously looking at how many. So in this particular time period, we've had 149. We're tracking those observations over time. We're tracking who the observers were. So as expected, most of them in this case are probably staff. We're tracking the staff interactions. So actually how many were good, how many were neutral, how many were poor. Tracking those staff interactions over time. Tracking, in this case, we're talking residents, but again, it could be patients. We're tracking those mood states. Again, are they changing over time? Are they getting better or worse? Do we have any kind of changes in mood states based on kind of days of the week? So is one day, for some reason worse than another? Again, staff interactions. So do they change over periods of time? Mood states by resident, again, could be patient. Mood states by location. So again, in this example, we can see for whatever reason, the kitchen and the communal area, people are not happy when they're in those particular areas. So maybe there's a maintenance issue, maybe they're not particularly kind of conducive to a good mood state. And then mood states by the interactions we're having. So, when a visitor is interacting with a resident in this particular case, as you would expect, they're positive because it's probably a friend and family. And then just the rest of it is basically just kind of trending over time, so positive and negative interactions over certain time frames. And then for individuals, so again, me and Ellie, how do we interact with the other individuals within the organisation? And then again, how does that trend over time? But again, back to that CQC framework and the we statements, the key things that they're after now are actually more feedback. So we've got a specific element for that where you can link this in through the dashboard, and then observations in there as well.
So the big change, Mark, is the observations and how the interactions are collected. And you, just to be clear, you can drill down through the observations and see what type of observations have been occurring. That's the big change, right?
Absolutely. So all of the data that we would have captured within this event, all of the information that we've been capturing in terms of who it was, any comments, any kind of narrative people were putting in, that sits behind this data. So yeah, the details behind this.
Right.
And then lastly is learning. So all of the new standard templates from Radar basically come with learning as part of what we call a workflow step. So in essence, there's an element and a process within any event where you've got the opportunity to add in a learning step. And so again, our dashboard, it's looking at how many lessons learned we've had across the events we're looking at. Our standard events track harm, so tracking physical harm and psychological harm in this particular case. We're then looking at that in terms of breaking it down in terms of physical harm levels and psychological harm levels. We're trending over time, whether these particular, because we're talking events in this case, whether these events actually reach the patient or not. So we're looking at all events here. It could be falls, it could be pressure ulcers, meds errors, all of the different things that might be affecting the residents or the patients. We're trending physical harm levels over time, psychological harm levels over time. We're tracking what event types were generating this. And then we're into trying to understand actually what is the root cause behind it. So what types of errors did we have? So here we've got administering, dispensing, obviously related to those medication errors. What were the contributing factors? So staff levels, quality of care, staff training. When did we detect this? So did we detect it after care, before care, in which case they're near misses, or during care and treatment? And then what were the lessons learned? So in this particular instance, and again, these in the forms and the workflows we provide, these can be configurable. So they could be your definition of the lessons learned, your categories. But most of our lessons learned in this particular case are around our systems and processes. And we can interact with this. So let's say, for example, we're interested in actually the severe harm that we've caused. We're trending those over time. So we can see straight away we've got a peak there for some reason in July. We can see most of them are down to medication errors. They were down to administering. Big contributing factor there was the quality of care. We detected most of them, as you would imagine, after care or during care. And our lessons learned were all about how we delivered care. And again, the reality is, almost to your previous question, Simon, the detail of that would sit behind that delivery of care. So you'd be able to drill into that and see the action plans, perhaps, of the narrative that people would have been putting as part of that lessons learned. And again,
yeah, that's really exciting, isn't it? Because what it probably gives further reason to use the pulse element and the analytics element of Radar's dashboards more effectively, because you're learning what the common themes are. You'd be able to look out for them more prudently than perhaps in the previous way that data was analysed through Radar. Is that fair to say?
Yeah, I think so. I think the big one for me is just a change in our structure for kind of our templated events. So a big thing around just the near misses. So obviously we haven't caused harm because it didn't affect anybody. We still might have caused psychological harm to people because they've been involved in this incident in some way, shape or form. But actually these are tomorrow's incidents. So to be able to understand actually your lessons learned here around, in this case, communication and how we deliver care, they're the types of things that actually those action plans, if you're putting them in place quickly enough and you're learning these lessons quickly enough, they don't become tomorrow's incidents. So just moving back to the CQC dashboard, and just to recap, so again, driven from an event, that event is typically the assessment or the latest inspection where you're putting the values in from the WeScore you've received from CQC, or it could be a mock inspection, because obviously you can duplicate it and create it as a mock inspection as well. And then the idea being behind these individual buttons is it's linking in basically to the templates that Radar are providing. And for existing customers or those on the builder license, these can drill into your own learning dashboards.
And I'll come to you for some feedback, Julie. Firstly, from what you've seen now, the full demonstration of what Radar can offer, do you see yourself simplifying the processes within the way you described it initially about gathering evidence and providing your observations in SharePoint files? This might be a different way of doing it.
Absolutely, Simon, and great work, Mark. Yeah, I mean, when I was watching that, I'm just thinking, we've done the groundwork with our team around, here are your evidence folders. You need to put evidence in here. When I share this with them, they're going to think all their Christmases have come at once, because Radar have done that work for them. And I think what was really impressive was the richness of the data. So currently we do a lot around looking at feedback and analysing feedback. So obviously use our dashboard for feedback quite a lot, in terms of reporting upwards to our managing director and things like that. But just looking at the information that was captured around feedback was fantastic. As I say, so much more rich and deep than what we've got at present. And I also think the learning lessons, the dashboard, how easy it is and how easy it's going to be able to demonstrate what lessons have been learned and how we are then going to take those lessons, the actions we're going to take to apply and to make those ongoing improvements. So absolutely, Simon, I think this is a game changer for the sector. Really do.
Yeah, thank you. Thanks, Julie. And it's great that you've got your staff in a particular mindset, but now the next evolution of that could vastly simplify lots of the things that they're doing and hopefully provide you with even more efficiencies. Antony, if I may, can I come to you, because you've been quite instrumental in helping us develop some of these dashboards, and some of the inspiration came from the lessons learned, and I just wondered what your thought was, particularly around the feedback and the lessons learned dashboards. Now that you've seen them in Mark's new dashboard suite.
Absolutely, Simon. I mean, it is really game changing. I think because if you take feedback, for example, feedback's great, and we've all been getting feedback, either informally or formally, for years. But it's actually how you then use feedback to improve care, which is the real secret here. And that's what CQC are actually driving at. They're not, it's not about how we evidence it necessarily. It's about how we actually use that feedback to improve care. If you look at all the quality statements, that's actually what they're saying. So that's tremendous. And then in terms of learning the lessons, well, if you look at how many times learning is referenced in the new single assessments framework, it's dozens and dozens and dozens. And there's, and there are quite a few quality statements which are very clear and have very explicit reference to learning. And in HC1, quite a while ago, I think it was well over a year ago, we created a learning lessons dashboard, and every incident or event type we have in Radar, we have a learning outcome, and we split that learning outcome into the themes, the trends from every single home we have. And that's not just across our English homes, that's across the whole 300 homes in Scotland, Wales and England. And it gives us the power to learn from thousands of events. And that's so powerful to in order to sort of prevent something that may have nearly gone wrong or did go wrong in Bristol happening in north of Scotland is an incredibly powerful thing. But again, the ability to show CQC that's about how you are learning and improving, as opposed to just saying we do a learning the lessons or we do a root cause analysis, or and it sits in a file. This is taking, and the Radar dashboard will take learning to a whole new level, in my view.
Yeah, a learning platform. I love it, Antony. Conscious of time here, Olivia, can I just ask you, do we have any questions, and do we want to, or do we? I'm not looking at the chat screen. So if you think, are there any viewers that are watching that have a particular question for myself, for Mark, or our guests that may want to? That this is now your forum. This is now your opportunity to ask us a few questions. Can I come to you, Olivia, and see if you have any?
Yeah, so we do have some questions. We've got some in the chat and the Q&A, so I will just flip between the two. So starting on the Q&A, so we've got a question from Rebecca Gibson. Are these new events going to be available for everyone within their current contract?
Yes, is a simple answer.
Yeah.
So anyone that's a Radar customer are going to receive the 2 new event types and the CQC dashboards free of charge. We took a conscious decision as a senior management team, and then further to our board, where we made the decision that Radar, having consulted with lots of you partners out there that we work with, that the right thing to do here would be to develop something that's going to be really usable. So that was the first and foremost. The second decision that we took was a commercial one, and we thought, no, we're going to add it for free of charge, because actually it's our response. It's the right thing to do, given the fact that some of you know that I run the sales team here at Radar, so we're in touch with lots of different people that are eager to know about Radar. So to be able to provide this free of charge, I think it was just the right thing to do.
Thank you. And we've got another question. So if you used Audit to complete a mock inspection, would Radar be able to automatically create an action plan based on these results?
So we don't automatically create an action plan. If you have an audit where you have a non-conformity against whatever your questions were, the system can enforce you creating that action plan. We wouldn't create the contents of that action plan, if that made sense. You'd have to think about what that action needed to look like.
Thank you. And another question, so how would we use the observation option to log for a digital healthcare provider with no face-to-face interaction?
So you could amend it. So I think one of the things just to get across, even in terms of both these form types, is these are templates. There are some questions in there that we need to drive those dashboards, but if you need to amend those forms to customize them to be more relevant to the services that you provide. So obviously the examples I gave in that demo were very kind of care home related. It was talking about residents. You can change the terminology on there, and you can configure those to be basically what you would need to capture to do the observation for your service, even if it was not necessarily against an individual. Again, those lists could be anything. You could, observe, something other than the options we gave you in those lists.
Yeah, I think the way to look at it is like any event type in Radar, that form is completely customizable.
Yeah, so just for clarity on that, we need some questions to remain because they drive the dashboards, but the other questions, which we pick through when we developed it with you, we can change those. And then again, in terms of this process, this is just our first version of these forms. These will evolve over time. This is kind of a V1 of both of these concepts. Customers will give us the feedback on how these might change. The dashboards will evolve over time. The events will evolve over time.
Precisely. A question just come in on the chat, which I wanted to ask anyway, but I'll come to you, Mark. It's asking, the attendee is asking, how will the QR code work for external professionals or family, etc., who don't have a login?
So if you did get a chance, I know it was only up briefly, but maybe pop it up on screen, Olivia, if that works in terms of the slideshow.
Yeah, just go back. I don't know. I don't think we can. It was in the video, unfortunately.
Oh, okay. Yeah, nobody wants to hear me in stereo again. So I think of it as you've got a really simple example. You've got the QR code. You've got a poster on a wall. It's some terminology around observations. As long as they've got a device in some way, shape, or form, they can just go on. They would get that. I think again it was mentioned on the chat. It's kind of like a cut down version of the one that I showed on the demo, because there's some questions that you're probably not going to be asking people, and then they can just go in and give you some kind of really straightforward, simple feedback of, look, I've been noticing these interactions between staff and staff, or between staff and residents. So again, just making it as easy as possible for people to be able to give you that extra information.
Just out of interest, Julie, Anthony, in your care organisations, do you use those external forms, QR codes? Do you use that at the moment?
The external
forms. So essentially, it allows a user to log information around an event without logging into Radar.
Right,
so you don't need to log into Radar. Yeah, it might be an opportunity to think about, particularly around feedback. It really works really well with feedback. Antony, HT1, not using that at the moment.
Yeah, we do some around feedback, but I think
right.
But I think ultimately this is the thing. I think this is completely the game changer for me, is the ability to because we want to gauge more people in observation, and because it's such a powerful tool, as I mentioned earlier, and I think this is fantastic. The ability to somebody to walk in there, quickly do a QR code and do that really simple form and immediately submit it to Radar. Imagine a district nurse, for example,
absolutely,
or a chiropractor or a podiatrist who comes in who hasn't got time to go back to the office and fill in a great big feedback form, or this is something that they could just do just like that. And I think the uptake will be great, and so I think it's such a powerful thing, not having to log into Radar.
Yeah, absolutely. And we saw the same, Mark. We saw that as the opportunity that actually you could have lots of different people making observations, providing feedback, and making it as accessible as possible. So yeah, thank you for putting that together. Olivia, any other questions that our audience wants to ask our team here?
Yeah, just following on from the QR code conversation, there's just a few questions on how you create this within your home. So it might be worth just covering that briefly.
I think, yeah, what would be really useful is, I think on the end of this webinar, we're going to put another QR code up, which will allow you to book a demo with us. And I think if you're an existing customer, we'll pass it on to your relevant customer, the success manager. If you're not a customer to Radar, it'll come across to the sales team, who will get in touch with you, and we'll properly demonstrate how this works in Radar. But because some of you are mentioning that you didn't know about this functionality, apologies if you didn't know. It's available on current event types, but again, refer to your CSM if you're an existing customer, or come through to me directly, and I'll point you in the right direction. But yeah, all accessible, all usable right now.
Thank you. And just a slightly different question. So we've got, will the data all pull from within Radar, or will there be any API? We have people's observations and quality leaders' observations in Nourish, which it would be a shame not to have in individual records.
Oh, it's a good question. I'll definitely put that one to Mark.
So at the moment, the information's all just coming from the event within Radar. We've obviously already got an integration with Nourish when we're bringing across an event from within their platform. That's probably one to bring up with us, ourselves and Nourish, and we can look to see how we might tie that into the kind of joint roadmap.
Yeah, perfect. And is it something similar with PCS, Mark?
I mean, it'll be this, if they've got those types of event types in, yes, anybody we would integrate with from a care platform point of view, I would imagine, not knowing all of the products, but I would imagine they've got a similar capability.
Great. Okay. Another question has come in on the chat. If you were using the event for a mock CQC inspection, is it an area for writing a narrative about the evidence you've just seen or observed and produce a score 1 to 4?
So the form itself, if you wanted to extend it and add in comments, you could add comments against each of the different we statements if you wanted to. You could add just a central comment, which would probably be the easiest thing, which comes against the event you've created, or there's yet another comments area in Radar. So there's lots of different ways of kind of adding that narrative in there that you can track as well.
Just as an additional comment, Mark, can you use dictation to off your phone, mobile device, etc., and it automatically populates and writes it for you?
It does. So it's based on your device, basically, speech to text functionality, where you can just, if there's a free text box in Radar, you can just narrate, and that would capture the whatever you're saying, basically.
And in the future, I guess you can produce some sentiment analysis around that free text. If I can just extend it even further.
You can. I mean, I think for us, sentiment analytics on something like the observation comments would be really interesting, but also on
really powerful.
Also on the feedback elements as well. So the complaints, the compliments, the concerns. So yeah, we're working on some models at the moment. Just gets kind of super technical, where we're actually doing sentiment analytics in the background and looking for that kind of patterns in the types of things people have been asking for. And then our view of the future of that is, at some point, probably when we're working on our kind of new technology stack, we're using kind of Gen AI to do things like automatically tag it and just give it assignments and categorizations based on the words people are putting into the system, rather than you having to tag things and ask questions. The future state for us is basically almost try to drive almost everything from a description somebody's putting, because actually the narrative somebody's giving is almost their specific view of the world at that point in time, and capturing lots of different narratives, even about the same event, to be fair, or about different things. Actually starting to use that information to drive the events within Radar, rather than it being, again, this is future stuff, rather than people having to fill forms in.
But I just thought I'd tee you up for the next webinar there.
that one will be a good one.
Yeah, so I'm just conscious of time, Olivia. I'm sure there's more questions that people want to ask, and please put on screen the QR code so people can fill in a form, and it'll come to us directly, and we will come back to every single one of you and run you through a demo, answer any of the questions that may have not been asked today. Before we leave, I just wanted to come to again our guest speakers today, Julie and Antony. And I just, in a world where this single assessment framework wasn't taking place, but this solution in Radar was, would this still be the way that you would operate and manage this? Because from many years ago, I ran my own care home, and one of the things that I always used to find frustrating, this is many moons ago, many decades ago, before technology played such a role, but it was always really hard to demonstrate. We knew we were delivering a really good quality service, but it's really hard to evidence that. And I just wonder now, if without the single assessment framework, Julie, would you still go ahead with a solution such as this in Radar to really show the quality of the service that the frontline carers are giving?
Absolutely, without a shadow of doubt, because from a governance perspective, something like this is so valuable, because it just easily shows you not only the care that's being delivered and the quality of that care, what people feel about that care, but also analyzes, identifies trends, and enables you to focus attention in places where you are going to get the most impact. So, working in the world of governance, absolutely, this is a gift.
Great. Thank you, Julie. Thank you for those final thoughts. And Antony, same question to yourself.
Well, absolutely, because fundamentally, the single assessment framework for all of us, whatever type of provider we are, is about us all working together across health and social care economy in an integrated way. And at the heart of that has to be the person's experience of their care.
Yeah, fabulous. Listen, with a minute to go, Mark, just any final thoughts that you may have?
Other than just to kind of touch back on what I said at the start about the development process, of just think of this as kind of our first version of it, and this will evolve based on, the minute it's out there and people start using it, we'll start to get that extra feedback coming in. So we want you to help.
And if I may push you, I'm sure lots of people may have asked it. When are they going to get it, Mark? That'll be the burning question, I'm sure.
So the observation event and CQC event you can access now, so you can get those loaded into the system if you speak to your CS representative, and then the dashboard for the CQC dashboard would be the end of the month.
Brilliant. So it's imminent, folks. So all that's left for me to say is my great gratitude to you, Julie. Thank you for coming and joining our session today. To you, Antony, joining us from the sunny island of Kos. Thank you for joining while you're on your annual leave. Really appreciate it. And Mark, eternally always grateful to this massive piece of development that your team have put together. Amazing. And last but not least, our presenter here today, Olivia, thank you for putting it all together, producing all the material. Really, really grateful. Thank you, everybody. Really enjoyed today's webinar. If you do have any questions, fill in the QR code form and me or my team will get back to you. Thanks a lot, everybody. Take care. Bye-bye.